All right, today we're jumping into one of the most amazing, high-stakes processes your body has, hemostasis. It's the incredible system that stops a tiny little cut from turning into a total disaster. And the heart of it all is this beautifully complex chain reaction that we're going to break down together.
Think about it for a second. That tiny slice is a breach in a pressurized system. So why don't you just spring a leak? The answer is this super fast, incredibly smart response system that kicks into gear instantly. And that's exactly what we're going to explore.
So anytime a blood vessel breaks, no matter how small, an alarm goes off. The body immediately sends out a call to a highly specialized construction crew. Their one and only job? Get to that site and build a dam, and do it like yesterday.
Okay, so here it is, the official blueprint, the Coagulation Cascade. I know, it looks like a subway map gone wild, but trust me, it's simpler than it looks. You've basically got two teams starting at the top, the intrinsic and extrinsic pathways, and they both meet up at the bottom to work on the common pathway. We're going to walk through this step by step. It'll all make sense, I promise.
So let's stick with this construction idea. The cascade is basically two different emergency response teams getting called to the very same site. Each team has its own way of getting started, but in the end, they absolutely have to work together to get the job done.
So on the left, we've got our internal survey team. This is the intrinsic pathway. It gets going when there's damage inside the blood vessel wall. It's very thorough, very meticulous, but it's a little on the slow side. Then on the right, you have the rapid response team, the extrinsic pathway. And when I say rapid, I mean it. This one is triggered by major tissue trauma, something happening outside the vessel, and it is the main, lightning-fast way your body kicks this whole thing off.
So how does that internal team operate? Well, it's a beautiful domino effect. Factor 12 gets the first push. That activates Factor 11. 11 then activates 9, and finally, Factor 9 partners up with its buddy, Factor 8, and together they're ready to head down to the main construction site. See? Just a perfect, logical sequence. Now, trying to remember that order, 12, 11, 9, 8, can be a bit of a pain. So here's a fantastic little trick. Just think. If you can't buy something for $12, try for 11, then 9, then 8. 12, 11, 9, 8. It's a super simple way to keep that chain of dominoes in the right order.
Now, let's look at the rapid response team. This pathway is unbelievably quick. When tissue gets damaged, it releases something called tissue factor, which is also Factor 3. That immediately flicks the switch on Factor 7, and that's it, just 2 steps. Boom, done. This crazy efficiency is why it's the main way your body starts clotting in a hurry.
So in the clinic, how do we make sure these teams are working properly? Easy, we time them. For the slower internal team, we use a test called the APTT, and for the super fast rapid response team, we use the PT, or prothrombin time. It's like having a specific stopwatch for each pathway.
Okay, so we've got these two different teams, two different pathways. Where are they both headed? They're both racing to the same spot with one single goal in mind: to activate the master foreman of this whole project, Factor 10. This is where the common pathway kicks off.
So once Factor 10 is activated, construction goes into absolute overdrive. Factor 10, with its assistant Factor 5, grabs some calcium and lipids and forms this powerhouse complex that turns prothrombin into the master builder, thrombin. And listen, thrombin is the absolute hero here. It takes these floppy soluble fibrinogen proteins and snips them into tough, insoluble fibrin threads that start weaving a net. But that's not all. It also goes back and supercharges other factors, creating this massive feedback loop that just amplifies the whole response. To finish the job, Factor 13 comes in like a welder and cross-links all those threads, making that dam super strong and stable.
Now, you can't have a construction project this powerful without some serious safety oversight. What's to stop this whole process from just going completely haywire and clotting up your entire body? Well, don't worry, the body has some really elegant braking systems built right in.
And here's a look at just how complex those braking systems are. You don't need to memorize every little line. But the big takeaway is that you've got multiple regulators, like antithrombin and protein C, that are always on duty, ready to step in and shut down specific factors. This is what keeps the clot right where it needs to be, at the site of the injury, and stops it from spreading where it shouldn't.
So let's meet these safety inspectors. First, you've got antithrombin III. He's the master inhibitor, shutting down not just thrombin, but a whole bunch of other key factors. Then you've got the tag team specialists, protein C and S. They work together to take out the key assistants, factors 5 and 8.
And finally, once the job is done and the vessel is healed, it's time for the demolition crew. Something called TPA activates plasminogen into plasmin, and plasmin carefully dissolves that fibrin dam, letting blood flow normally again.
So that's how it's supposed to work. But of course, sometimes there are errors in the blueprint. Or sometimes we need to intentionally slow down the construction crew. And that's where medicine comes in, giving us ways to actually hack the cascade.
So let's look at two of the biggest tools we use to hack the system: warfarin and heparin. Warfarin is a pill that stops the body from making factors that need vitamin K, and an easy way to remember which ones those are is the year 1972, for factors 10, 9, 7, and 2. Since it hits factor 7 in that rapid extrinsic pathway, we track it with the PT test. Now heparin works totally differently. It basically puts our own natural safety inspector, antithrombin 3, on steroids. And since most of its targets are in that slower intrinsic pathway, we monitor it with the APTT. See how it all connects?
And finally, what happens when the blueprints themselves have errors? Well, in hemophilia, a key engineer is missing, usually factor 8, which messes up the whole intrinsic pathway. In von Willebrand disease, it's like the special glue that helps platelets stick is faulty, and that glue also protects factor 8. And then there's DIC. This is a system-wide meltdown. The cascade gets triggered everywhere at once, using up all the factors and platelets. And in a cruel twist, this massive clotting spree actually leads to massive uncontrollable bleeding.
When you just step back and look at the whole picture, you realize this isn't just a list of factors. It's this incredible, delicate dance between building up and tearing down, all happening in a blink of an eye, all to keep you safe. It really is a powerful reminder of the hidden genius that's running inside of us every single moment of every single day.